Well, on this bright August morning, we're on our way to Johns Hopkins for the follow-up visit 6 months after. I've got Brasco with me. And within 6 months, I've taken the blood test, and the blood test, from what I've seen early in my portal, indicates that I'm still at 0.0 as far as my PSA is concerned. And but the hardest part has been just trying to stay qualified to pay for the medication, which runs about $13,000 a month, which is crazy. As a patient, it just seems crazy you have to worry about paying for medication like that. But that's part of the game, you know. But we're on the road headed back to Baltimore, and so we want to see how things are going from the doctor's perspective. My roadie Brasco is here. Good morning, Brasco.
Morning.
She wakes up with a smile on her face every morning.
Be truthful, baby.
She wakes up like a barracuda, with a beautiful barracuda. No, I'm kidding.
That's what said that, not that. But
no, I'm kidding about that. But once again, your emotional support is very important. And getting your financial support and keeping that is crucially important. And let me answer the question, the elephant in the room question. You can still have sex. And here's the difference in the sex thing. It's not that you can't have sex. I mean, if you're in good shape and you're eating a plant-based diet, this is what works for me. Okay, works for us. I'll say that. If you eat a plant-based diet and you're in shape in the first place, you should be pretty good. Whereas, let's say you were active. Let's say previously I was active. What would you say? 5 days a week?
yeah.
Right. So I go from 5 days a week to maybe 2 or 3 days a week. 2 days a week.
Good days.
2 good days.
Two
Yeah.
really good days.
2, according to her.
Really good days.
Well, thank you,
I'm just saying.
All right. 2 really good days. There we go. From testimony. Testify. Okay, 2 really good days. But it's not a matter of function. It's a matter of lack of testosterone. It's kind of weird. It's not that you don't want sex. It just doesn't cross your mind as quickly as it does when you have testosterone in your system. Because you have to remember, my testosterone is down to zilch. Like 0 zilch. So that also means when I work out, it's hard for me to recover from the workouts. It's hard for me to keep off weight, you know.
And some of them guns, the muscle, the musculature is not.
Yeah, they didn't soften. The muscles done softened up. They're not as cutting hard as they used to be. They still there. The irony is that the strength is still there, right? But where I used to throw around 100, 110, 120s, now I'm down to 80s and 85s and 90s, you know. So man, I went in on beast mode, and I'm still on beast mode. But you know what? It's an endurance race. So lift weights is what I would recommend more than anything else. Lift weights. You're going to gain weight, okay? Because I was hovering at about, what do you think, about 179?
Yes, 180.
180, like literally 180, right? Now my weight hovers at about 190.
A little more than that.
And more than that.
Come on now.
Yeah, I'm talking about my good days. Because 180, 179 was a good day back before, you know. So my best days were 180, 179, 180. Before this, 190. Typically, I'm about 194, 195. So you're going to gain weight. It just matters what kind of weight you're going to gain. You know, you can gain muscle weight or you can gain fat weight. It depends on what you do. This looks like the road we have always traveled, baby.
Yeah.
I mean, this is like going back to your old neighborhood after you done graduated and gone.
Oh yeah.
You know, like you done graduated and gone and going on and got your career going. And you come back to the neighborhood one time and say, let's see how things have been back at the hometown, you know? It feels like it was a lifetime ago when we were going here every single day.
My name's Dr. Gardner. I work with Dr. Song.
Good to meet you, Dr. Gardner.
Likewise, who do you have here with you?
My Brasco, my life partner.
Again, nice to meet you as well. How are you feeling?
I think I feel good.
Think?
I mean, I feel good, but you might tell me that my body is killing me inside and I don't feel it.
No. Just the opposite. Looking at your numbers, your PSA looks amazing. It's not even detectable.
Okay.
Which is what we want to see
Okay.
after you finish with treatments. Okay.
Okay.
So you finish your treatment in February, actually, and then you had some radiation to the pelvis part that finished in March. Have you noticed any new bone pain or anything kind of?
Actually, I ain't even thought about that. I hadn't. No.
No. Okay.
No, I totally forgot about that.
Forgot about it.
Yes.
Yeah, I hadn't said anything about it. Yeah, I forgot about that. So.
No pain there. How are your symptoms as far as urinary symptoms go? Any urinary frequency? Were you peeing more than normal?
When I pee a lot.
Okay.
And the only thing that's been happening in the last 4 weeks is that, like, when I don't drink a lot of water, like if I got a little amount of pee, it burns a little bit.
Okay.
But when I have a lot of pee, it don't burn at all. So it seems to be concentrated. Like, so it's kind of a warning to me when I don't drink enough water.
Did you kind of dehydrated?
I think I'd probably be dehydrated because I do a lot of walking.
Yeah. Do you sweat a lot?
Yes,
Yeah.
I do.
Sounds a bit like dehydration, and most likely that pain that you feel is actually coming kind of from the bladderish area. Just saying that you're kind of dehydrated. So I would recommend, if you're going to be doing a lot of activity, if you're going to be outside, you're going to be sweating,
I got to drink more water.
Some water.
That's fair.
For sure.
That's fair because I'm not drinking enough water.
Otherwise, and you said it's every now and then, just when you're not having a lot of urine flow. Otherwise, you don't have the irritation.
No. No, I don't have pain. I don't have a burning sensation every time.
Good.
No.
Perfect. And bowel movements?
Fine.
Okay. No loose stools or burning or irritation with your
No,
bowel
no burning or
movements?
irritation.
Any blood in your stool?
No, I haven't had it. I've been waiting for that to happen because they said 6 months later it can happen.
It could. And it's very, chances are really low for that happening, but some patients do have what we call proctitis, so irritation of the rectum. Doesn't happen a lot, but I still say continue to look out for it because even 6 months, 12 months, 18 months out, you still can be at the risk of having that happen.
Okay. I can't grow any muscles, but if I miss, I lose muscle.
Right, yeah. Some of that's going to be due to the ADT, the hormone therapy too that you're taking.
Right.
And so sometimes it's hard to gain muscle mass while you're on those medications, but we do recommend continuing to do like aerobic exercises like walking or running or jogging, because what we're trying to do is kind of keep your weight kind of in the same area, because we know these medications it can cause weight gain as well as bone loss. So if you continue to do exercise, aerobic exercise at least, I mean weight training is good as well, but at least getting some aerobic exercise, the walking, the running, if you're a swimmer, something like that to really, really, really keep your bones kind of as strong as possible.
Okay. Good, how are you?
Hi, how are you?
All right, so Dr. Gardner provided me the update, and it sounds like everything is overall going well, if you agree with that. There are other strategies for erectile function. They're not as easy as taking a pill. So I would say, max out the Viagra at first, but if that's not satisfactory, then there is something called a vacuum pump. And essentially the way erections occur is through blood filling the penis. What this does is it's a chamber you place over the penis, and it creates negative pressure, and it basically pulls blood into the penis, and then there's a little ring that you put over the base of the penis, and the patient's report, it lasts for like 30 minutes. But it's not as easy or convenient, but it does generally work. And then the other strategy is intra.
Is that the needle?
Injections.
Yeah.
Yes.